For the advanced breast cancer patients, I think the most important message that one can give now is that you are no longer alone and no longer forgotten. There is a whole community who has been dedicating these last 10 years and will continue to dedicate efforts to understand what is the situation, where can it be improved, and what can we do alone and together to change the situation. So it's very important to pass the message one to one that it is not your fault that the disease came back, because this is the fault of the disease and not the person. Even with the best treatment, 30% of breast cancer do come back. And so it's not the fault of the patient that it came back. And there are now specific resources, so look for them, look for good quality information. Be careful with everything that you find in the internet, because not a lot is well done. I always say be careful with Dr. Google, because he's not right all the time. But look for good sources of information, then pass on the information to other patients, and join groups and organizations. Nowadays, the social media and the internet has made the world a smaller place, and particularly for those patients who have access to the English language, there's a lot out there for you, and you should take advantage of that. And lastly, the report also showed that less than 50% of patients actually voice their needs to the physicians. For some reason, either because they are afraid of saying exactly what they feel, or for other reason, cultural reasons, patients are not telling the doctor what their preferences are, what would they like to take as decision to continue treatment or not, to choose between treatments according to the types of side effects. One side effect may be very important for me, less important for you, and vice versa. So don't be afraid to speak with your team. And if there is any cultural or other reason not to approach your physician, try to approach the nurse or the psychologist, but one member of the team, and tell them what are your preferences. And don't be afraid of doing that.